Hello and welcome to this short video about the training pathways in psychiatry in the UK. Over the next couple of minutes we'll be talking you through what you need to do to maximise your chances of getting to be a consultant psychiatrist in the shortest possible time. It all starts as a medical student. You do need to be a doctor to become a psychiatrist, but you can do things like joining your local psychiatric society, or becoming a student associate of the Royal College, or doing an elective in psychiatry. During your foundation year, you might want to consider doing a program that contains a psychiatric job, or doing a taster week or some audit and research in a psychiatric topic. That way, when it comes to applications to core training, you've got a lot to talk about. The applications are managed differently in the 4 countries of the UK, but they all run to a common timescale. Usually people will be applying in January for the jobs and having interviews in February and April. In England you do it through the Royal College website and log in to complete the application forms online. In Northern Ireland it's the MMC Northern Ireland website and the address is there. So that's www.nimta.gov.uk/MMC. And similarly in the other devolved nations, in Scotland it's mmc.scot.nhs.uk, and for the Welsh application you go through the Welsh MMC site, and that's at mmcwales.org. If you're successful in the interviews, you'll start your CT1 job in either a general adult or an old age post and build up general skills in psychiatry. And after you have 12 months of psychiatric training under your belt, you're eligible to sit the written papers of the MRC Psych examination. Usually you would sit these papers 1 and 2 during the CT2 year, and then during your CT3 year you would aim to sit your written paper 3 and the clinical exam, the CASC. Once you have completed all of the MRC Psych exams, you're eligible to be a member of the Royal College. You can put the letters MRC Psych after your name, and you can apply to higher training posts. At this point in your career, you need to specialise and choose one of the 6 different specialties in psychiatry. And your choices here are general adult, old age, child and family, forensic, psychotherapy, and learning disability. During higher training, you'll be expected to take on more responsibilities and build up the skills that you need to be an effective consultant, while special interest and research sessions allow you to build up your own areas of expertise. You'll need to take on more responsibilities for teaching and supervising junior doctors, and start to learn about medical management and leadership. There are lots of competencies in the college's curriculum and you can find out more details there, but once you've completed that, by the end of your ST6 year, you will receive your certificate of completion of training and be eligible to apply for consultant psychiatrist posts in the specialty that you have completed your higher training in. It doesn't stop there though. You still have to show that you are progressing and learning and keeping up to date with all of the latest advances, and that's important for revalidation and relicensing through the GMC. Well, that takes us to the end of this whistle-stop tour through the training pathways in psychiatry. If you want to find out more, there's plenty of information on the student pages of the Royal College website, and you can read about the actual experiences of trainees in the different specialties.